Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Thursday, February 19th. I'm Elizabeth Arkalian. Kern County has a maternal health crisis. Mothers and babies die there at a higher rate than almost anywhere else in the state.
But even this more recent data does show that Kern County still has one of the highest rates of pregnancy-related mortality of any county.
Coming up, KVPR Associate Editor Kerry Klein revisits findings from her investigative reporting from 2022 to see what, if anything, has changed. But first, these headlines. 8 dead and 1 person still missing. That is the latest update from authorities on the avalanche north of Donner Summit in the Sierra. 6 other skiers were rescued from the site near Castle Peak and Frog Lake on Tuesday night. Here's Nevada County Sheriff Shannon Moon.
We did have a conversation with the families of the folks that are still outstanding and let them know that our mission has went from a rescue to a recovery.
Moon says the skiers were part of a backcountry ski group ranging in age from 30 to 55. The avalanche is being considered the deadliest in California's modern history. California's Department of Justice is challenging a mental health diversion that was granted to a former Kern County supervisor. A judge allowed Zach Scrivener to undergo a mental health program instead of facing a trial for claims of child abuse. But that diversion program has been criticized by lawmakers on both sides of the aisle, and now the state's DOJ is seeking to reverse that ruling. Attorney General Rob Bonta's office filed an appeal with the 5th District Court. The CEO of the California High-Speed Rail Authority is on leave after he was arrested and then released earlier this month. KVPR's Crescencio Rodriguez Delgado has this report.
Ian Chaudhry was allegedly involved in a domestic violence situation at a home in Folsom, just outside Sacramento. Folsom police responded to an emergency call and arrested him, but later released him. The local DA declined to press charges, and police did not release details of the arrest. It occurred earlier this month, but the public only learned of it this week when a TV station reported the news. Chaudhry is now taking a few days off from his job over the incident. He was appointed in 2024 to reinvigorate the high-speed rail project. It has been mired in delays and cost overruns for years. Chaudhry has experience in building big projects around the world and had most recently been focused on improving the project timeline. The day of his arrest, he was in Kern County celebrating the completion of a construction milestone. For KVPR News, I'm Crescencio Rodriguez Delgado.
Vermont U.S. Senator Bernie Sanders is joining the campaign for a proposed billionaires tax that has set off an uproar in California's Silicon Valley. Sanders has long railed against the country's wealth inequality. The tax proposal has not qualified for the ballot yet, but it calls for imposing a one-time 5% tax on the assets of billionaires. The proceeds would backfill federal health funding cuts for lower-income people. The proposal has created a rift between progressive Democrats and Governor Gavin Newsom, who opposes wealth taxes for fear that they could hurt the state's economy. Republican Congressman David Valadao introduced a bill to protect Americans of the Sikh faith from rising hate crimes. The congressman, who represents Hanford and Bakersfield, introduced the so-called Sikh American Anti-Discrimination Act. It would direct the U.S. Attorney General to establish a task force to track and address crimes against Sikhs. The Valley has one of the largest Sikh communities in the country.
If you start your day with Central Valley Daily and are looking for a companion program in the afternoon, there's All Things Considered. Hi, I'm Sarith Hawk. Each weekday afternoon, I'm on KVPR's broadcast, bringing you the day's local and national news. Join me for All Things Considered, weekdays from 3:30 to 6 on KVPR. You can also stream us online at kvpr.org, through your smart speaker, and on the KVPR app.
And now to our main story. Back in 2022, KVPR brought you a series of investigative stories about pregnancy-related mortality in Kern County. Specifically, reporting revolved around data that showed that moms and babies in Kern County were dying at higher rates than the rest of the state. Now, 3.5 years later, has pregnancy-related health changed at all in Kern County? KVPR Associate Editor Kerry Klein joins us now to bring us some updates, including a doctor who's been disciplined and some new data that addresses some questions and leaves others unanswered. Welcome, Kerry.
Hi, Liz.
Okay, so to start, your investigative series from 2022 consisted of 5 pieces, and you focused on one particular doctor. Let's start with a bit of a recap of your findings from about 3.5 years ago.
Sure. So that series actually kicked off even years before that, back in 2019, when I got an alert from the Medical Board of California that a Bakersfield obstetrician had had his license suspended after a few of his patients had died. That included both babies and mothers. His name is Dr. Arthur Park. And I found when I began to dig in that those weren't the first of his patients to die, and it wasn't the first time he had been investigated for negligence. In fact, the medical board had first accused him of negligence in the year 2000, and again a few years later. He eventually surrendered his license while I was reporting that series. But that raised questions of how the medical board investigates and disciplines doctors if he had had this whole history before he eventually surrendered his license. And as I dug into the story, I also explored the greater healthcare landscape in Kern County. And I found that maternal and infant mortality in the county were higher than in most other counties in the state. When it comes to infant mortality, the county was on a par with the national average, but the national average is higher than the state average. And more mothers were dying in the San Joaquin Valley as a whole than in any other region in the state. So the series looked into all of those issues, tried to find some answers as to why, and it involved interviews with mothers, healthcare experts, and patient advocates in the region.
Okay, mentioning those striking health disparities in Kern County, what were some of the main things that were causing those?
So it wasn't entirely clear. And that's part of the problem and part of what my reporting centered around. Mm-hmm. I spoke to a number of healthcare experts who offered some suggestions. There were doctors and researchers at the Kern County Public Health Department, the state public health department, at a maternal coalition at Stanford University. They all said, we don't really know. But they guessed it, it could include, and when I say guess, I mean educated guesses. It could include the region's high poverty. That's really been tied to a lot of health outcomes in a lot of different areas. Or there are social determinants of health in general, like exposure to air pollutants and unclean water, unsafe neighborhoods, things like that can all affect health overall. But the problem all around was they all said that there's enough data to show the problem, these maternal and infant mortality rates, but not enough data digging into why. And all of that would require some further research.
Well, as I mentioned, you first published the investigation in 2022, and there is some recent data that gives us an updated view on maternity care. So what do things look like today in Kern County? And I think the big question is, has the maternity care crisis improved at all?
And the answer is not appreciably, at least not as far as we know. Part of the reason for that is there is some new data, but not a lot. The state has updated its pregnancy-related data by a few years. Now, the latest data we have is from 2022. I should note, however, that when I published that 2022 series, the most recent data I had at that time was actually from years before that, 2018. So 2022 is more up to date, but it's still not all that recent. Mm-hmm. And so it's hard to tell if the trend has changed at all in just the last few years. Also, notably, it's actually hard to break the data out specifically into infant or maternal deaths. And in fact, the state actually generally condenses both of them now into a measure called pregnancy-related mortality. But even this more recent data does show that Kern County still has one of the highest rates of pregnancy-related mortality of any county, and the San Joaquin Valley has the highest rate of pregnancy-related mortality of any region in the state.
Okay, so since 2022, have there been any significant updates to your reporting? Any changes that would be helpful to point out?
Yeah, there's one notable change, and it's actually about a specific doctor. His name is Dr. Hans Yu. So I'll back up a second. I mentioned earlier in this interview a doctor named Arthur Park. He was the focus of a lot of my original reporting. That's partly because of his involvement in the really high-profile case of Demi Dominguez. She was a 23-year-old woman who died of a blood pressure condition known as preeclampsia. She was pregnant, very far along, and her infant son was delivered by postmortem C-section, but he died as well after just a few hours. These two deaths really drew shock and outrage and heartbreak from the community. They were very public at the time. And Arthur Park had seen her in his office just a few days before her death. He had not diagnosed her with this condition, this preeclampsia, this blood pressure condition, even though there were some signs of it at the time. And the fact that he missed this condition was part of what actually led to the medical board accusing him of negligence, this exact case. But the reason I bring this up is because there was a second doctor who had seen Demi Dominguez in the days before her death, also missed this diagnosis. That was Dr. Hans Yu. And what's new now is that last year in 2025, he was investigated for gross negligence and put under probation. And then just last month, he was ordered to cease practicing because he violated one of the terms of probation when he failed to pass a competency exam. And he can't practice again until he passes that exam. And now this is interesting for many reasons. There just aren't that many doctors in Bakersfield. And according to Michelle Montserrat Ramos, this was really tough on patients. Montserrat Ramos is a patient advocate with the nonprofit Consumer Watchdog. And she says, there just isn't a huge pool of doctors to choose from. Plus, they may not all accept every patient's insurance, and this can be really tough on patients.
It created mass confusion because, these moms didn't know where to go. Some were going to deliver that weekend, and they didn't even know.
Yeah, you can imagine how difficult it can be to find a doctor on a regular day. So for expecting mothers who are certainly on a timeline, that's pretty shocking to hear.
Yeah.
So obviously, these regional health disparities don't get solved overnight. Are there people like Michelle Montserrat Ramos advocating for more improvements? What might they be working on now?
Yeah, definitely health advocates out there. So Michelle Montserrat Ramos, as I said, she's a patient advocate with Consumer Watchdog. She's been really closely watching maternal and infant health in Kern County for years, for longer than I have. She knows Demi Dominguez's family personally. Patients come to her when they have questions or complaints. And she's working to bring a lot more awareness and advocacy to this issue. For instance, she helped get the Kern County supervisors to acknowledge May 2023 as Latina Maternal Health Awareness Month in the county. She also helped bring the Medical Board of California to Bakersfield that same year for one of its quarterly meetings. That's the first time they'd ever done that. And they got to hear from some of the patients that she works with. She's also identifying some parts of the medical board's complaint review process and advocating to make that process more efficient. She's also advocating with a couple of research agencies at Stanford and at the state to do a really detailed review of the Central Valley to help answer some of these questions of why these geographic health disparities are so pronounced.
We're kind of looking at the entire landscape and trying to figure out what's needed and, what we can do with local stakeholders to try to assist in saving some of these lives.
Okay, before I let you go, Kerry, I'd be curious to know at this point, what questions do you still have as you look back at your reporting from 3.5 years ago? Any unanswered questions or sort of lingering thoughts on your mind?
Yeah, I think there's just a huge gap in data. There's some about infant and maternal mortality, and we certainly know a lot nationally about the maternal and infant mortality rates. The rates here in the U.S. are higher than a lot of other developed countries, and that data is easier to get because it is still rare enough that it's easier to calculate these rates within a larger population at the country level rather than at the county level. But without this really detailed, recent local data, it's hard for health experts to know how to take steps to solve this issue locally, even when we know it's a big problem nationally.
KVPR Associate Editor Kerry Klein, thank you so much.
Yeah, thank you, Liz.
And that is today's show. If you ever have a story idea or perhaps even feedback for Central Valley Daily, don't be afraid to reach out. Just send us over an email at podcast@kvpr.org. Today's episode was produced by Kerry Klein, Jonathan Linden, and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.
This is Tanya Mosley, co-host of Fresh Air. You'll see your favorite actors, directors, and comedians on late-night TV shows or YouTube. But what you get with Fresh Air is a deep dive. Spend some quality time with people like Billie Eilish, Questlove, Ariana Grande, Stephen Colbert, and so many more. We ask questions you won't hear asked anywhere else. Listen to the Fresh Air podcast from NPR and WHYY.